Hello, I'm Dr. James Bogash, Master of Health and Longevity and creator of Modern Health Mist. And today we're going to go over the latest hype that has seemed to have arisen over the CDC's updated numbers and the reality of what these numbers say, what's changed, what hasn't changed, because just like everything else going around with COVID, there's a lot of misinformation. So, we're going to start with the fact that this has been all over the news and um, lots of titles saying the CDC updated their numbers and really only 6% of the people they said have died from COVID have actually died from COVID, or that would be around 9,200 deaths. And that everything that we've done is just hype and scare and media stuff. Well, the reality is that nothing really changed. Those numbers aren't any different. They're still the same. They've still the same numbers. They've updated the numbers based on the date, but they haven't really changed anything or the way they're reporting it. So, so this wasn't really a secret ploy to downplay COVID deaths, and now they've been found out, and there were some changes, and now all of a sudden we have new information that has come to light. That's just not true. So, that being said, there are some interesting facts to look at when it comes to these numbers from the CDC, and I'm going to point out 3 of them that I find interesting. And so we have all this uproar over the 6% number, and we're not really looking at the numbers and how to interpret them, and that's what's always the most important, is to take the damn politics and the title reading people out of the mix and look at what the numbers really suggest and say. So what is the 6% number really? These are the people that have died of only had COVID. Either COVID, the virus itself really did kill them, or they just maybe anything else wasn't put on the death certificate. But that's where the 6% number came in. There were no other comorbidities that were listed on the death certificate. So, of course, the other side of the coin is that 94% of people who have passed from COVID had other comorbidities. Like, this isn't anything new. We've known this from the beginning, that other diseases like high blood pressure, obesity, diabetes, underlying inflammation is really probably the key factor there. They drastically increase the risk of death from COVID, and nothing changed from a week ago, from 6 months ago to today in that factor, that comorbidities drastically play a role significantly in the outcomes of people once they are infected with SARS-CoV-2. So if you haven't heard that pre-existing conditions play a role, either A, you've been living in a cave, or you were sequestered on some submarine for the past 6 months and you've just opened the hatch and come out into a completely brand new world. So for me though, it's beyond frustrating that 6 months later we're still not talking about these diseases and how to better manage them. I think that is just, for me, it's the pink elephant in the room, wearing a tutu, ballet slippers, and dancing salsa while quoting Shakespeare. It is this huge monster of what COVID really is, and there is no discussion about it. There's lots of fear, but we just have this belief that everyone is equally at risk of developing and dying from COVID, and that is just absolutely, positively not true. You could certainly look at a couple very incredibly small percentage of outliers, but the vast majority of people who have had bad outcomes with COVID have pre-existing conditions, and that remains the elephant in the room. We are not talking about this, and we are certainly 6 months later, we're still not addressing it. As a result of this, I am going to start producing a short series of videos on what we can do today to start lowering our risk of COVID, so stay tuned for that. So I mentioned I was going to talk about three three things that I did find interesting in this report. And the first one is this concept of excess deaths, which happens to be my favorite way of looking at things. And I think that's probably the smartest way to look at it. And when you look at, so right now in the United States, the number of excess deaths, if you look at the week, the report by the week, there were a couple months there, like April and May, where those numbers were really high. There's other weeks where they are the same as the number of deaths are what we would expect. And when we say expected deaths, they compare them to prior years and how many people on average die, because newsflash, people die from other shit that's not COVID. And we're going to talk about that in one of the other points. And so the looking at excess deaths, you can't look at these numbers and say that nothing's going on, if this is a hoax. People are dying at a higher rate, more than expected, from something, whether we think it's asteroids hitting us or but whatever. So people that say that this is a hoax is certainly ignoring the fact that we have had excess deaths. Now keep in mind, the reason I like that is the COVID, excess deaths catch COVID deaths, but it also catches extra deaths as a result of our response to COVID. So people that were afraid to go to the hospital, that had a heart attack or stroke or appendicitis, that did not, or even cancer screening, which we're going to see some of that later. It's not an emergent thing like heart disease or stroke, but we're going to see those numbers increase over time. But for now, those people that died that wouldn't have otherwise died if they weren't afraid to go to the hospital, that is kind of counterbalanced by less accidental deaths. People weren't out driving, they weren't at work. We didn't have those deaths, so that excess deaths kind of catches all of that, and that's one of the reasons why I like that. If you notice in the graph, those numbers of excess deaths are starting nationwide, are starting to come back down to normal. So we are not having any more people dying now than we would expect to die at this time for the past 10 years or whatever. So very important thing to consider. Number two is to look at the percentage of total deaths that this COVID thing has created. Because I just mentioned it, if you aren't aware, people do die of other things. And quite frankly, we can't stop death. We need to get this out of our head. Society seems to think that we can eliminate all deaths from everything, including infectious diseases. And guess what? It ain't gonna happen. The second, you really can't understand everything until you get that thought out of your head. So if that's something you think that we need to reduce the deaths down to zero, it's not gonna happen. And you might as well shut off any videos I've ever created ever, because it doesn't make sense and it's not gonna happen. Prior to COVID, we lost people from communicable diseases, like viruses and bacteria, and we lost them from non-communicable diseases like heart disease and stroke and diabetes. It's still happening. It's always happened. It's the nature of life and how we live it. So the total deaths were 9.3% of total deaths for COVID. It's not really a big scary number, and it kind of puts that in perspective, that somebody dies and the first question is, well, was it COVID? Because we seem to think that nothing else can kill anybody right now, and despite that, the COVID deaths were only a very small percentage of people who had died from other things like heart disease. In that same time frame, on average, we lose 431,000 people to heart disease, 404,000 to cancer, and another 93,000 to stroke. Those two, heart disease and cancer, still dwarf the number of people that we've lost. And I just don't understand why we have so much fear with COVID and not from these other diseases. It makes no sense to me, because people are still dying at much, much higher levels of these other diseases, but people aren't terrified of that. And I think that all it boils back down to the fact that we think we don't accept responsibility that we can actually make changes that will lower our risk of getting infected. So in other words, I really don't have a good description for it. There's no reason why we shouldn't be just as terrified of heart attack and cancer and stroke as we are of COVID. Many more people die of that every year, day in, day out, year in, year out, decade after decade, from something that is almost 100% preventable, like heart disease. But there's no fear, there is no anything related to heart disease like we see with COVID. It makes no sense to me, and it is anything but a logical view on the scenarios and the stats. So, to put the example, it's kind of like being afraid to fly, but you're okay with driving. And any pilot will tell you that you are far safer flying than you are driving. We have the same idea with COVID, that we're terrified of this over here. Not terrified enough to make lifestyle changes, mind you, but we're terrified. And yet, we're not afraid of things like heart disease and cancer. And yet, they're dwarfed. The deaths from COVID are dwarfed by those we lose to heart disease and stroke. And don't get me started about what about all those people who don't die from COVID, and we have this all these nebulous these things that are happening. Well, guess what? That's always freaking happened. Heart disease? A recent study in Annals just came out last month in August. They found that 12% of people hospitalized for the flu have acute cardiac events. In other words, this isn't anything new. Heart damage from viral infections are not anything new. We didn't terrify the country, the world, we didn't shut things down, we didn't say what if. It's always happened. We're just now looking at COVID through a microscope that we've never looked at anything before, and I'm confident that if we looked at things with influenza and other viral illnesses, that we'd find these same long-lasting concerns that nobody stopped the presses for and barely blinked an eye at, and yet that's what we throw out if we need to consider this. People who had COVID and now are still recovering, which, by the way, it takes time to recover from a viral infection, especially if you're treating yourself like crap and not taking care of yourself. It's going to take time to recover. Again, all of these things we're seeing are not unique to COVID. Any viral illness, anything that ramps up the immune system can have these kind of effects, and just understand that they are not unique to COVID. So the last thing I found interesting is that when you look at the state-by-state data, New York and New Jersey remain a much different experience than the rest of the country. We have the deaths in New York and New Jersey accounted for 27% of the deaths in the United States. And yet, for some reason, we superimpose those numbers and that experience in New York, and we transfer it across the country. And despite the fact that New York and New Jersey have not been reproduced, we still act like they're going to be at any moment's notice. That if we take our masks off, or we go say hi to somebody, or we forget that COVID is out there, that all of a sudden New York and New Jersey are going to reproduce themselves, and we are just not seeing it, and we haven't seen it. I think part of that is that we are managing things much better on the front end. We've got a better idea of how much low-dose steroids may help combined with antibiotics because of the steroids. Just giving antibiotics without steroids doesn't entirely make sense, but I do believe we're managing cases better than we did when everything was new back in New York and New Jersey. Despite that, we still act like it's New Jersey and New York, and it's going to repeat itself over and over again. If we took those numbers out, the numbers across the United States would not look nearly as scary. Not to say that people wouldn't still be scared. And stay tuned for another video I'll make within the next couple days about the infection mortality rate in Indiana, and those people who said it's not like the flu are going to be upset to find out that it was actually, the infection mortality rate is lower than what we see with seasonal influenza. So in summer, we have 6 months of collective experience under our belt, and they just don't look that scary based on having a much more mile-high view than we did in the early stages. The early stages might have been time to panic, but as soon as we started getting more information, we should have backed off and started looking at this logically. Unfortunately, the entire fear cycle had started, and we can't seem to break through people's fear. Throw politics in the mess, and it just gets ugly. And so then the response would be, but our response is what kept the viral numbers down. And I would counter by saying that no, that this is how a virus responds. It hits an area, it hits the susceptibles, then it wears its way down, and you generally don't see another bump in the countries that got hit hard, countries or states. So looking at New York, they haven't had any uprisings. New Jersey hasn't had any uprisings because, quite frankly, there's every bit of evidence to suggest that the virus has worked its way and it's done with those countries. And so if you look at that across the globe, you'll find a very similar pattern. And whether our masks and social distancing and everything, social distancing certainly makes a difference, but not in the long run. People are still going to get exposed to this virus, but hopefully this is a little bit more of a objective view on the numbers of the CDC, and all politics and everything aside, because I could really give two rat's butts about politics, and gives you a better idea of what these numbers really say and show, and to look into the numbers to get some better information. As always, make sure you like this video, share it with somebody who you think is terrified and needs to have their eyes opened to what the data really suggests, and subscribe to the channel.